Welcome everyone to another Wellness Webinar Sunday. I'm Amy Liebman, President of NTM Info Research. I'll be your host and moderator today. And on behalf of everybody here, thank you for joining us again. Today, we are delighted to welcome back Dr. Devin Smith, who will present on changing thought patterns to decrease stress levels. Dr. Smith is a licensed clinical psychologist with more than a decade of experience researching and treating mental health concerns and psychosocial factors unique to chronic illness. She received her bachelor's degree in psychology at Oklahoma State University before completing a clinical psychology PhD program at Washington State University with an emphasis in health psychology. During her training and throughout her career, she has provided health psychology interventions in a variety of settings, including oncology, primary care, internal medicine, cardiology, pulmonology, and infectious disease. She received specialty training in sleep treatment while working at the Georgia Cancer Center for 2 years. In 2018, she was recruited for a faculty position at Augusta University Medical College of Georgia, which involved creating a behavioral sleep medicine clinic. Currently, she is an assistant professor at National Jewish Health in Denver, Colorado, and works within the sleep medicine and NTM fields. During today's webinar, you can ask questions using the Q&A function on Zoom. Click on that Q&A box there on your screen, type your question into the box, and then click on Send. At the conclusion of the presentation, I will read questions for Dr. Smith to answer. Today's webinar's broadcast is being recorded and will be posted online at a later date. So if you missed the answer to one of the questions, you don't have to worry, you'll have the opportunity to hear it again. Make sure you mark your calendars for next month's webinars. Dr. Michelle McDonald from National Jewish Health will present on the nutritional management of GERD on Sunday, October 3rd. Also next month, Dr. Smith will return to present on living life to the fullest with chronic lung disease on Sunday, October 10th. Registration is now open for both these webinars. And make sure to join us for another Science from Your Sofa webinar on Tuesday, October 26th. Dr. Valentina Guerini from Rutgers University and Dr. Ross Klingsberg from Tulane University will present on their research into novel approaches for the discovery of treatment monitoring biomarkers in NTM lung disease. Registration will open soon for that webinar. You can also learn more about NTM Info research and sign up for our electronic news at ntminfo.org. You can find us on Instagram, Facebook, Twitter, YouTube, and LinkedIn. And now I'm going to turn this over to Dr. Smith. Thank you, Devin, for taking the time to be with us again today.
Of course. All right, I'm going to go ahead and share my screen with you all. Give me just a second here. Okay, Amy, can you see that okay?
Yes, we can.
Okay, and it's the full view?
Yes, it is.
Perfect. Okay. So good morning or afternoon, everyone, depending on where you are right now. I'm in Denver, so it's technically still morning. So today I'm going to talk to you about changing thought patterns to decrease emotional distress. So I've touched on this before if you've listened to any of my other webinars, but one of the powerful ways that we can change how we feel is to change how we think. So what I'm going to go through today is I'm first going to talk a little bit about the link between thoughts and emotions and how that link works. Then we'll talk a little bit about some common patterns of unhelpful thinking. And then we'll also talk about strategies to make thought patterns more flexible to decrease this distress. So we'll kind of go through all of it. And like Amy mentioned, if there's any questions, just type them in and I can address them at the end. So thoughts and stress are definitely linked. And, you know, some of you may be aware of this, some of you may be less aware, but one of the first things, and I'll talk about this in a little bit, that we want to try to do is to increase our awareness of this. Because when a situation occurs, we automatically have thoughts that come into our head. So this influences then how we feel and how we behave. So a lot of times we don't have to sit there and think about things in order to have these automatic thoughts. It's just something that pops into our head. And we tend to latch onto these thoughts that come to mind first or most often, regardless of the accuracy of them. So if we tend to be someone who kind of thinks negatively, maybe sees the situation more negatively, those are going to be believed more easily than if we try to convince ourselves of something positive. But latching onto these thoughts that are negative, inaccurate, or unhelpful can create these patterns of negative self-talk, which can end up impacting how we feel overall. Since our body can't tell the difference between positive stress, so positive stress would be, moving into a new house, moving to a new city, or negative stress, like losing a loved one, being diagnosed with a chronic illness. Our body can't distinguish between the stress that comes with positive or negative. So increasing our thoughts and increasing our awareness of thoughts and feelings and the link between the two can help us better manage our reactions to these situations. A lot of times, if you're experiencing a lot of negative emotions, that can be a good indicator that you might be experiencing some of these automatic unhelpful thoughts. And so if you look at this little infographic right here, you can see that an easy way to get ahead of all of this, like I mentioned, is how we interpret the situation or how we think about the situation. It can result in changing how we feel, but also how we act. And so I'm going to show you an example of this right now. What I want you all to do is, if you could pull up your chat, you can answer this question. You can either send it to host and panelists or everyone if you want everyone to see, but I'll read out some of these answers. But what do you think is happening in this image when you see it? So if you want to type in your chat box to me, what do you think is happening in this image? Okay, so someone said bad news. Okay, yep. So a doctor is consoling an upset patient. He got bad news from the doctor. Let's see, comfort is being offered. The gentleman has just been told that he has a serious illness. A doctor is reassuring the patient, comforting the patient. Patient got good news. The man got bad news, someone being diagnosed, not good news, comforting, relief. So there's some sort of news and this person is being comforted is what I'm hearing. So patient either relieved at the results of bad news or bad news from a diagnosis. Okay. And so what feelings and sensations are associated with your interpretation? So for whatever you said, what do you think the feelings are, or the sensations are that this person would be experiencing? Negative, okay. Fear, okay. Helpless, sad, loss of control, worry, overwhelmed. Negative, okay. Stress, yep. So what factors into your interpretation, do you think? So however you interpreted that image initially, what made you think that? Was it certain aspects of the picture, where the hands are placed? Was it an experience you had? Was it a memory you had? What factored into your interpretation, do you think? Where the hands were placed. Okay, so like one has his hand over his face, hand on the shoulder. Someone said, been there, done that. Someone else said hands. Okay, the way he's holding his head, an experience that you've been there before. Had doctors touch me at just the right moment. Hands on shoulders, hand over the person's face, past experiences. Okay, man shutting out information by covering his eyes, covering the face. Okay. So try taking a different perspective. So for those of you particularly that said he's getting bad news, he's being comforted, what else could be happening in this image if you were to take a completely different approach to this interpretation? Relief, okay. Relieved, yep. He was just told his wife delivered a beautiful baby. Thank God I'm okay. He's getting good news and is relieved. Um, a new baby, he's getting good news. Relief at good news. Okay. So if you try to take a different perspective, it is possible to view this situation differently. And so I've used this image before in treatment protocols for people that are undergoing stress related to chronic illness. And a lot of times, my patients that I do this with struggle to come up with an alternative situation to this. And that can absolutely happen when you are in a situation where it's just hard to see an alternative. And so a lot of you could come up with an alternative. Maybe this man's covering his face. He's so relieved. He's overcome with emotion. The doctor is comforting him. So there's an equal likelihood of something bad versus something good. But what our experiences flavor how we see things automatically. And so I like this quote here. This is actually from Hamlet, but there's nothing either good or bad, but thinking makes it so. So this is a powerful explanation, really, that, people can interpret situations totally different. So it explains why some people are happy to have an opportunity to sing in front of a crowd. They're excited to do that. Whereas other people would be terrified. I would be one of those people that would be horrified if I had to sing in front of people. It can explain why some people are very anxious and some people are very sad. We have the same situation, but nobody reacts to it 100% the same way. So really, it's this interpretation that comes into it. So often it's not the events or situations that bother us, but the thoughts that come along with it, the meaning that we interpret from it. So instead, the way we interpret events or the meaning we give to it is what gives rise to our feelings. So in this example here, let's say a friend walks past you without acknowledging you. You're in a grocery store, you're on the street, you walk past a friend and they kind of just keep walking. Maybe they glance at you and don't say anything. You might notice that you have a feeling. You have an instant feeling that happens. So you feel anxious or tension in stomach. Some sort of unpleasant, feeling comes across. And really, if you think back, it's oftentimes because of how you're interpreting that situation. So this person here said, I must have done something wrong for her to be upset with me and not acknowledge me. And so that's where the anxiety came in, is what they were telling themselves about the meaning behind this situation. However, if you interpret it differently, she must not have seen me. She looks like she had a lot on her mind. The feelings are different. So concern for the friend, relaxed, not necessarily good or bad. It's just a situation. And the thought is, maybe something's going on that I'm not aware of. The second interpretation here really understands the friend's behavior in a more neutral terms and leads to a different outcome. In this first situation, you're probably not likely to necessarily reach out to the friend, or this person might not be likely to do so because they're anxious. They feel like they've done something wrong. They don't want to upset the person. Or they have the opposite reaction. They reach out a ton and they're, completely overwhelming the person because they're worried they did something wrong. Whereas if you think that that person's having a bad day, they have a lot on their mind, you might just send a quick text, hey, is everything okay? I saw you in the store. I don't think you saw me. Something very casual. So how we react to situations really are based on not only how we feel, but how we interpret the situation. So another quote I like, and this is something I talked about last time. If you haven't read Man's Search for Meaning by Viktor Frankl, he was a Holocaust survivor. Excellent book that talks about how we can adapt and thrive through really terrible situations. But one of the quotes that I like is, everything can be taken from a man but one thing, the last of the human freedoms, to choose one's attitude in any set of circumstances, to choose one's own way. So although we can't always change situations that we find ourselves in, or we can't change, the people people's reactions and responses. We are in charge of how we think about a situation and how we respond to it. And so the attitude that we bring to a situation and the perspective we try to take often determines how we feel. I'm going to talk a little bit more about this later on, because the goal isn't to live in a fantasy land where everything is positive and everything's fine and you don't see bad. And no, that is not the goal at all. In fact, there's probably some harm that comes with that, in kind of living in denial. Instead, the goal is to see all sides of the coin, to see all the possibilities. So in that example from before, yes, that friend could be mad at you, or that friend could be having a bad day. But the goal is you see both possibilities and you don't just hook on and automatically latch on to one. So automatic thoughts, what are they at the very base? Because if you read about cognitive psychology or cognitive behavioral psychology, there's a lot that talks about our automatic thoughts. And these are what I kind of hinted to in the beginning, in that these are thoughts that come into our mind without much effort. And so we all have these, it's not unique to any one person. And oftentimes they're believable because it's how we've always thought, and it's how we view situations. And it's based on what psychologists call models, not necessarily the actual situation at hand. And so our models are basically how we view the world, how we view how the world works. So it's a result of our history, our experiences, our beliefs, sometimes our upbringing. It's basically how we understand the world around us. And they serve in our favor. So models aren't necessarily a bad thing. It's a sort of mental shortcut, so we don't have to go about our lives overthinking every situation in extreme detail to be able to act. That would be paralyzing. So there is an advantage to these mental shortcuts or these models, but there's also some disadvantage, because once these models have formed, they're hard to change and they're not always accurate. So a lot of times when people form a model about how the world works, headphone fell out, they might kind of pay attention more to information that fits with that worldview. So it's a sort of confirmation bias because you're only seeing the things that fit with that model. Or someone with a really strongly formed model might pay less attention to information that contradicts them. So basically kind of twisting information to make it fit with this model, because we don't like when things don't fit with our worldview. It's uncomfortable. So we will twist information to sort of make it fit in with how we typically think, or our typical worldview. So really, models act like lenses through which we see the world and which color our perceptions, including of ourselves. So this isn't just of other people or situations, but also how we view ourselves. So these models are really powerful, and they drive our automatic thoughts, which, as I mentioned, can then impact how we feel and how we act. So you've probably heard of this before. Can everyone still hear me, by the way? Amy, can you still hear me?
Yes,
okay, just making sure since my headphone fell out.
No.
Okay, thank you. So we've probably all heard of this analogy before. Is the glass half empty? Is it the glass half full? Are you a glass half empty kind of person, a glass half full? But really the goal, like I said, is to see all sides of the spectrum. So usually there's another way of looking at the situation, even if it's not immediately apparent to us. And there's not necessarily a right or wrong in a lot of situations. It can be helpful if we view things as and, not or. So the glass is half empty and it's half full. It's both. Developing that flexibility is what's been linked to reducing distress in research. So like I mentioned, it's not necessarily 100% believing, okay, this glass is half full, I believe that 100%. No, it's about being able to see both. Yep, the glass could be half full and it can be half empty at the same time. So, what are some common types of unhelpful thinking? So, psychologists have started to identify these different types of thinking. Initially, they used to call these uh, types of thinking uh, cognitive distortions or maladaptive thoughts. If you've ever done CBT before, you may have heard those terms, but more and more often we're shifting away from that because we don't want to place value or judgment in someone's thoughts. Really, what it comes down to is, are these thoughts helping you in these situations, or are they hindering you? So, not are they right, are they wrong, are they good, are they bad? Are they helpful or are they not helpful? That's a good way to think about it. And so, as I read through these and talk about some examples, you might realize that you fall into some of these and others don't apply at all. But typically, we all end up having some sort of unhelpful thoughts or patterns of unhelpful thoughts with our automatic thoughts. So the first one here, all or nothing thinking. It's also been called black and white thinking, but essentially this is viewing things in extremes with no in-betweens. So all or nothing thinking causes people to feel like small mistakes or imperfections, feelings of inadequacy or worthlessness. So it's a really extreme type of thought where you say, this is 100% true 100% of the time and nothing else. You can't change my mind about this. That's all or nothing thinking. So life is rarely one way or the other. Rarely is something, completely one way or the other. Rarely are people all good or all bad. It's a lot more intricate than that. So there's some benefit to seeing the grays. You can see this is crossed out here, but the goal is to view things as somewhere in the middle, seeing things on that spectrum. So an example here of all or nothing thinking is, if I'm not perfect, I've failed. Either I do something right or I don't do it at all. Those are extremes. And there's some benefit to kind of stepping back from this, and we'll talk about how to do that. Overgeneralizing, so seeing a pattern based on a single event or being overly broad in the conclusion we draw. So you can tell this is from a British author, but everything is always rubbish, nothing good ever happens. So you're taking one event or a handful of events and you're only drawing these conclusions that everything is always going to happen this way. I see this a lot of times when people are predicting that something bad is going to happen based on, the few times something bad has happened in a similar situation. And yes, something bad could happen, but something not so bad could also happen. So we can't predict the future 100%. We can have a guess at what's more likely to occur, but we can't say with 100% possibility or 100% certainty that something is going to happen. Mental filter, so only paying attention to certain types of evidence. This is common when people are feeling more down on themselves. So noticing our failures, but not seeing our successes at all. So someone, that tends to be maybe a little bit more down on themselves might do something and see it as a failure, even if it went pretty well. So, an example would be, you give a presentation at work and you notice all the things you did wrong in that presentation and you don't see the things you did well. You just see the things that you did wrong. Similarly, disqualifying the positive. So discounting the good things that have happened or that you have done for some reason or another. So this, again, happens a lot of times when we're more down on ourselves, but seeing, if we get some praise at work or we get good news, oh, that didn't really have anything to do with me. It was just luck. Kind of disqualifying the positive things that happen to us and blaming external factors versus giving ourselves the credit where credit is due. Okay, jumping to conclusions. So there's two types here. One is mind reading, thinking we know exactly what other people are thinking. We don't know what other people are thinking. And I talk about this with my patients all the time. The best we have is certain cues to alert us to what someone might be thinking or feeling, but we can't actually physically see thoughts in someone else. We can't physically see emotion. We can see that someone isn't making eye contact, or they rolled their eyes, or, they said something and it sounded like they were sighing. We can read into these cues, but we can't read their minds to know exactly what they're thinking. So we can fall into these unhelpful thinking styles when we're mind reading. We think we know exactly what someone is thinking, and we have feelings and base our interpretations and behave basically on unconfirmed thoughts. Fortune telling, predicting the future. So there's been a lot of research that looks at how people predict the future. And a lot of times it's inaccurate. So we're not good fortune tellers. We're not good predictors of the future behavior. We think that, there's a common example that, if I didn't, say someone gets in a car accident and they think, if I didn't drive this direction, this wouldn't have happened. But there's actually no evidence to suggest that if you didn't go this one route, you wouldn't have gotten in a car accident in another route. So basically kind of predicting things and telling the future, but also looking at the past and thinking, if I had done something differently, there would have been a different outcome. Some things, yes, there is a strong likelihood that if you had acted differently, maybe the outcome would have been different, but you can't tell that for 100%, certain. So really predicting things or giving explanations to things where we can't say it with 100% confidence, but we're thinking it with 100% confidence. Emotional reasoning, assuming that because we feel a certain way, what we think must be true. So if you feel embarrassed in a situation, this example is, I feel embarrassed, so I must be an idiot. I feel so embarrassed, so I must have said something wrong. Putting a lot of weight in our emotions and telling ourselves that these emotions are because of certain things, without really seeing all the different sides of the spectrum. Labeling, assigning labels to ourselves or other people. I'm a loser, I'm completely useless, they're such an idiot. So labeling in like situations where you're in traffic, that might be something that happens to you commonly. But, basically not seeing different interpretations of similar events or the events that are at hand. Catastrophizing or minimizing, so blowing certain things out of proportion, catastrophizing, or inappropriately shrinking something to make it seem less important. Again, this tip, the minimization tends to come in with lower self-esteem, not giving ourselves the credit where credit's due, and then catastrophizing, basically thinking that everything is going to fall apart, the worst possible scenario is going to happen, and we're telling ourselves that, and it impacts how we act. If we tell ourselves we're going to fail, we're more likely to act in a way that would cause us to fail. Shoulds. So anytime you hear words in your thoughts, should, must, basically ought, it's basically applying shoulds to situations where, there's no one way someone technically should act. We might have a belief that someone, it would be nice if someone reacted a certain way. But putting those shoulds or musts, especially on other people, results in a lot of frustration. So, kind of thinking about how we think about situations and should someone be doing this or must we be doing something? And then the last one here, personalization, blaming yourself or taking responsibility for something that wasn't completely your fault, or conversely, blaming other people for something that was your fault. And so these are just some common types of unhelpful thinking that can come up when we talk about automatic thoughts. As we move forward and I talk about some ways to address these, one thing is to kind of look at these types of thoughts and see if you're falling into any certain traps more often. So getting to kind of the next part of this, what do we do about these unhelpful thoughts? So, a lot of times our go-to is to push them out, to ignore them, things that are uncomfortable or we don't want to think about. We try really hard not to think about it. Um, there's a classic psychology experiment. They call it like the white polar bear experiment. I've also heard it called the pink elephant. But basically, the idea behind this is they had people sit down in a room and they told them for a minute, don't think about a white polar bear. So for a full minute, think about anything but a white polar bear. Don't think about a white polar bear. What do you think people thought about for most of that minute? The white polar bear. So even for the people that said, no, I didn't think about it, when the researchers asked more questions, like, how do you know you didn't think about it? Are you sure? They got less and less confident that they didn't think about it, or the way they knew they didn't think about it is because they were checking in throughout that minute to see if they were thinking about the white polar bear, which is kind of like thinking about the white polar bear. So the more we try not to think about something, oftentimes the more we end up thinking about it. Also, once we stop trying to think of something, or once we stop trying not to think of something, there's a tendency to think about that thing more than usual for some time after. It's a rebound effect. So we call it cognitive suppression. They really it can have an effect that's strong. And it's particularly stronger if the thought is painful or emotional. If we try really hard not to think about something painful, it tends to weigh on us even heavier. So pushing thoughts out or ignoring them is not the best thing for unhelpful thoughts. What we actually want to do with unhelpful thoughts is start by noticing what's going through your mind. So if you've listened to my webinars before, you've probably caught on to this trend of the first step to almost anything is to create awareness. So first, before we even change how we're thinking, we have to know what we tend to think about or what thoughts tend to come into our mind. So when you start paying attention to what's going through your mind and what you're actually thinking about yourself, about other people, about the world around you, particularly paying attention during times when you notice a change in how you're feeling. So if your emotions start to change, start to tune into what you're thinking and what you're telling yourself. When you notice an unpleasant emotion, ask yourself, what was going through my mind just then? Kind of pausing and thinking about that. You can even write it down. So there's a little example here for a simple thought monitoring record. The trick is, if you're going to write a thought down to increase awareness, you have to do it as quickly as possible with no filter. So don't try to change what you thought. Don't try to minimize it or put an extra layer of interpretation on it. You want to write it exactly how it happened. And the quicker you do it, the more likely it is to actually be accurate. So you can see, oftentimes what happens is in these situations, you might notice an unpleasant emotion pop up. And so that might be the box that you fill out first. So let's see. Here, this person, let's say they started feeling anxious and they're feeling quite anxious from 0 to 100, 80% anxious. And so they might start checking in with what they're telling themselves and what's going on. So who are you with? What are you doing? Where are you? When did this happen? So out with friends Thursday evening, kind of the situation that's occurring. And then what was going through your mind as you started to feel this way? So the thought they were kind of telling themselves is, I'm going to make a fool of myself. So really checking in when these unpleasant emotions come up to see what you're telling yourself about yourself, the world, other people, or the situation. Once you create kind of a basic awareness or understanding of what's going on in your mind in different situations, you can start to address how you think. So one of the things that, one of these strategies that I love is called unhooking. So basically you want to diffuse from the thought. So a lot of times we buy into the thought 100%, with that example of, I'm going to make a fool of myself. We tell ourselves that that's true. That is 100% true. It's not, up for debate. That's a fact. But all it is a thought. So when you start to see things as just thoughts, it takes some of the power away from those thoughts, and it decreases your distress. So noticing that, when you have a thought that's maybe not helpful, saying that this is just a thought and not all thoughts are true. So calling it for what it is, a thought. Noticing a thought without believing it or struggling with it. So not necessarily, trying to fight the thought, but just noticing that you're having it. Stepping back and observing without getting tangled up. So the thought here, I'm useless, versus I'm noticing I'm having thoughts that I'm useless. There's a big difference there, right? One is you're telling yourself that this thought is the truth, I am useless, versus I'm having a thought that I'm useless. There's a lot less power in that one. Seeing thoughts for what they are, just words or pictures, and also letting thoughts come and go. So they call this unhooking because of think of a fishing hook. So, you could hook, you could, choose to bite every hook that comes up, every thought that comes into your mind, or you could notice it and swim past it. And so the goal here is to observe your thoughts versus being in your thoughts. That's another way to look at it here. Watching it from afar versus getting caught up in it, being in the thoughts. So once you can kind of diffuse from your thoughts, it can also change how you feel in a lot of situations. Another way to address this is through some different strategies here. So like I said, you don't want to start with this necessarily. You want to start with just general awareness. But once you kind of get some awareness and where your patterns tend to lie, for me personally, I tend to fall into the catastrophizing category. I know I have a lot of catastrophizing thoughts. And so, now that I have that awareness, I can start to work backwards and challenge some of those thoughts. So what you want to do is when you notice negative feelings coming up, trying to work backwards and looking at your thoughts and maybe reassessing them. So the first step or recommendation here is being your own lawyer. So take your thoughts to court. What's the evidence for this thought and what's the evidence against it? Is this 100% true 100% at a time, or could there be an alternative? And reworking the thought to more accurately include both sides. So again, you don't have to necessarily rework your thoughts to believe 100% that this thought isn't true, but to at least have that little bit of, okay, maybe this thought isn't 100% true. Maybe it's 80% true, but still there's benefit in seeing that 20% of, there could be an alternative to this thought. What are the potential consequences? So especially if you're catastrophizing, what's the worst that could happen and how would you handle it? So if you get very sick and you go into the ICU, maybe that's your worst case scenario. How would you handle it? Okay, what would you do? Kind of thinking through a realistic scenario, having a plan, and considering what might happen if things go right. So yes, you could end up in the ICU, or there's a possibility that if, you take care of certain things, maybe you don't end up in the ICU. But a lot of times when we kind of unpack what is the worst case scenario, we realize that sometimes it's not realistic. So trying to think of an example, for me with catastrophizing, let's say that I'm kind of worried about, something with my job and I'm telling myself I'm going to fail. Well, what's the worst case scenario if I do fail in some situation? Maybe I'm telling myself in the back of my head, well, I'm going to lose my job. Well, how likely is it that I'm actually going to lose my job from not doing my best, one time? So kind of thinking through the worst case scenario and Is it realistic? This one is really good when you struggle to interpret things for yourself in the same way that you would interpret for other people. So what might you tell a friend in the same situation? We're much harder on ourselves than we are on other people. So thinking about, okay, my friend comes to me with this concern or this thought, what's the advice I would give them? Oftentimes it's not going to be, you're a terrible person, you can't do anything right. Like, we're not going to say that to a friend, but we might say that to ourselves. So how could you do it? What could you tell yourself differently? Taking yourself out of that point of view and looking at it as, okay, what would I tell my friend? Is your thought a fact or an opinion? So we may have told ourselves something so many times that we see it as a fact, but it's still an opinion. So a fact is observable and 100% provable. Recognizing the difference between a fact and opinion can help us challenge harmful opinions we have about ourselves and others. So looking at something and saying, am I telling myself this as a fact, or is this actually an opinion? And disconnecting between the two or discerning between the two can be helpful in how we interpret it. Does your thought include extremes or exaggerations? So whenever these words come into your thoughts, always, forever, never, need, must, should, can't, every time, those are extremes. Those are cues that maybe you're not thinking in a helpful way. Try describing the events in less extreme terms. So, I'm disappointed in myself that, I didn't do this, certain action. And I know I can react differently next time. You're acknowledging, you're not saying I'm always going to react like this, I'm never going to do anything right. You're acknowledging that, yeah, maybe you didn't react in a way that was ideal for you. And you can still make a change and do something differently next time. Reminding yourself of your strengths. So every time you're hard on yourself, also reminding yourself of times you've done things right. So balancing out some negatives with some positives. This is another good handout, and I can send these handouts as well so that you all can have a copy. But basically, when you're looking at your negative thoughts, some questions that you can ask yourself to try to get some different perspectives. So, again, am I confusing a fact with an opinion? Are these thoughts helpful to me? So if a good friend knew I were having this thought, what would they say to me? Am I catastrophizing? Kind of looking at these types of unhelpful thinking that we talked about and seeing what's applying to this situation. And so the goal is to write an alternative thought. And so I'll kind of walk you through an example here, because the goal is to come up with something more balanced. So whenever you're challenging a thought, the goal, like I said, isn't to 100%, live in a reality world where, you 100% believe the other alternative, but the goal is to see that there is an alternative. So in this example here, let's say that someone is at home, Saturday night, no plans. They're having these automatic thoughts about, being a loser, being a failure, being pathetic, asking themselves evidence again that supports the thought. This is usually the easy category. We can usually think of why we're having these thoughts in the first place. So, someone didn't have a relationship for 5 years, all these things about why this person is pathetic. And again, those are probably easy to come up with. The harder one is evidence that does not support the thought. So in this example, my friends would tell me not to be so hard on myself, relationships aren't everything. And so the goal is to come up with a balanced thought that acknowledges, the evidence for, but it also acknowledges the evidence against. So when I'm feeling low, I often judge myself harshly. Life isn't going how I want it to. So again, acknowledging that things are not how you want it to be at this moment. And these feelings tell me that I need to make some changes. I need to look at relationships, whatever you want to tell yourself. But the goal here is you see they're blending the two. And the goal is to change your emotion or your feeling related to that by kind of coming up with this more balanced alternative thought. This is kind of taking the thought monitoring and putting an extra spin on it. So not just monitoring your thoughts, the situations and the feelings, but also kind of coming up with these alternative thoughts. And you can fill out we call these thought records. You can fill out thought records for this, but you can also do it in a less structured way, where you just try to think through it. Okay, and then before I finish up, just a few considerations that I like to throw out anytime we're talking about challenging thoughts and automatic thoughts. So some situations don't have a valid alternative, or it might be more unhelpful to try to challenge your interpretation of a situation. So examples are, domestic violence, experiences of racism, basically any sort of experiences of prejudice, abuse, violence, or mistreatment. You don't need to reevaluate those situations, or your interpretation of those situations. That's not on you. So a lot of times other skills could be more helpful, focusing on kind of de-stressing, kind of coming down from those experiences. But the one way you can work in thoughts is to challenge how you negatively evaluate yourself based on how you are treated by other people. So if you're constantly, facing prejudice for one thing or another, you can start to internalize that and tell yourself things about yourself that may not be true and are definitely not helpful. So looking at how you're talking to yourself about yourself, that's where you can sort of come in with these challenging thoughts. But to challenge your interpretation of the situation isn't really something that's going to be helpful. Another consideration, you may or may not have heard of this before, is toxic positivity. So if you've ever seen things like be happy, there's these stickers that I think they have like a yellow smiley face, or I can't quite picture it, but the message is be happy, just be happy. And that's actually pretty toxic. So we're not meant to be happy all the time. It's not realistic and it's not helpful. So toxic positivity definition is overgeneralization of a happy, optimistic state that results in denial and invalidation of authentic human emotional experiences. Pain and suffering is part of being human. And to say, don't think that way, don't worry, be happy, those kind of messages aren't realistic, and it's actually probably toxic. So in this little meme here, sitting in a burning building and thinking this is fine, that's delusional. That's denial at its finest. And the goal isn't to come up with thoughts that are, completely unrealistic and overly positive and minimizing. It's about balance. So you can see here, toxic versus more mindful positivity. Who has time for pain when there's so much to be grateful for? You can't waste time being sad. Look on the bright side. And I'm sure you've all heard messages like this before, or been told messages like this before. And that people can have a reaction to that, like it's hard to think that when there's really hard things going on in your life. Instead, thinking, okay, this is painful and that's okay. Life can be painful. I can be hurting and have hope that growth will come from this, or that the situation will get better, or, insert whatever. But you can kind of see the difference between the two. One is, buying into the positive alternative 100%, and one is balancing the negative with the positive. And that's always the goal. So in summary, basically, situations happen. We have thoughts and interpretations of the situations that often come automatically, and it flavors how we feel and then how we behave in certain situations. So our interpretations are really powerful drivers of our emotions. So understanding how we think can increase our awareness of these patterns that may be causing distress. So once we notice these patterns, we can start to diffuse from the thoughts and challenge unhelpful thoughts, making them more balanced and flexible. So like I've kind of, you know, beaten into the ground over and over again in this, the goal is to see all sides of the spectrum, not necessarily living in extremes. And then just a reminder, if faced with unfair situations, biases, prejudices, you approach those a little bit differently than trying to challenge the situation. Also, trying not to fall into that toxic positivity trap. So, all right, I ended about 10 minutes early, so I can have any questions or thoughts.
Thank you, Devin. That was
Yeah.
wonderful. I invite everybody, if you have questions, drop them into the Q&A. Somebody had asked about making the slides available, and yes, we will make the slides available to everybody. So we do have a question in the Q&A. Are unhelpful ways of thinking considered a mental health issue, or is it just a plain old human issue?
It's a good question. So I think it can be both. So, I think all of us have unhelpful thoughts and they're not necessarily pathological. So just because you have unhelpful thoughts doesn't mean you have a mental health disorder, although certain types of unhelpful thoughts and patterns of thinking are definitely more common in certain mental health conditions. So for instance, depression, you're going to see lots of unhelpful thoughts if you're depressed. But that doesn't mean that if you're not depressed, you're not going to see unhelpful thoughts. It's just maybe the frequency of them and the believability of them increase when you're under a mental health crisis.
Okay. I don't see any more questions in the Q&A. We had a lot of conversation in the chat earlier. Oh, wait, we have just had one pop up, my mistake. How do you avoid being sad that due to illness, you are not normal or able to live the way others do? Do you have any specific suggestions on dealing with the fact that there is no cure for our illness? You'll continue to have to work hard to keep it from getting it worse, and it may be likely to.
Yeah, so I think some of the breaking down and challenging those thoughts a little bit more specifically. So, Amy, can you say that one more time? The thought that the person.
Yes, sure. Let me pull that back up and I will.
Sorry.
How do you avoid being sad that due to illness you're not normal or able to live the way others do? And do you have any specific suggestions on dealing with the fact that there isn't really there's no cure for the illness and that there's a likelihood that this is going to continue on for them?
Yeah, got it. Okay, so I would definitely unpack what normal means. Like what are you telling yourself is normal? And yes, maybe there are things that are different in what you have to do and how you're living, but does that make it necessarily abnormal? How would you define normal? And then also, if I don't know if you were, if you heard the last webinar, but radical acceptance is one of my favorite tools for when things are really challenging and you're fighting reality. Kind of trying to work towards accepting reality as it is versus fighting reality. So I guess those would kind of be my recommendations, is to look at what you're telling yourself. Like if you're telling yourself all the time, I'm not normal, that's really going to weigh on how you think about yourself, how you behave in situations, and maybe trying to come up with an alternative. Yes, I can't do things the way I used to, or I can't do things the same as, my husband or wife. And I still live a productive life, and my life still has meaning, or, kind of coming up with that balanced thought.
Okay, thank you. And yes, all of our previous webinars do get put up onto our YouTube channel within a few weeks, so you'll be able to see that soon. Okay, well, I think, oh, hang on. What do you tell yourself when you get news that you need a treatment because you're going to have pneumonia, but you know that you can't handle the treatment? Those thoughts keep coming up for this person.
Yeah. So that's a tricky one because I don't know, I don't know your specific situation and your past and your experiences, but whenever you're telling yourself, I can't do this, you know, trying to look at a way, is there a possibility that, this time could be different? Can I make a change? Can I make an adjustment? Is there a different treatment? How can if I can't change the situation and I do have this terrible reaction, how are you defining handling it? So does that mean that, it's just miserable and you're suffering, or, does it mean, it's something unpleasant and that you have to push through, and, it's something that can, be dealt with? So I guess challenging how you're looking at that situation. And maybe you are thinking of it totally accurately. And so if you are, there's other skills that you can apply, stress tolerance, stress management, but also looking at, making sure your thoughts are 100% accurate. And if they're not, what are the alternatives?
So we have a couple of interesting questions in the queue. Somebody's asking, does this connect to they're saying vax versus anti-vax thinking, I guess vaccine hesitancy thinking?
Yes. Yes, it does.
Okay.
Yeah. I don't know how much I want to get into that, but yeah. Definitely, the more, so you can be vaccine hesitant or you can be anti-vaccine. And those are two totally different things with two totally different recommendations. Because if you're anti anything, your model of how you think about it is only going to be reinforced when someone tries to present alternatives. Someone's going to kind of dig in more. But if you're hesitant, that's totally different. So I don't know if that answers the question.
Oh, yeah. Here's a really good question that I think maybe will lead to some, helpful, helpful conversation. And I don't know if you, and you'll tell me if you want more input from people here. Somebody's asking, how do you deal with the friends or family that do tell you those toxic positivity things all the time, when it in fact makes you feel worse, like you're thinking, negatively? I don't know if you have any recommendations. I'm not sure if other people have recommendations who are listening and maybe want to put that.
I mean, that would be awesome if other people want to chime in. But, my go-to is always, and it depends on the relationship and the dynamic, but, maybe this family member, these people, they know nothing about toxic positivity. Because I know I used to think, it was helpful and upbeat to say, like, oh, cheer up, it'll be okay. I didn't realize that those were hurtful or harmful messages. So sometimes just showing people, explaining what toxic positivity is, showing that, the slide and sharing that information with them can open people's mind to that. So I think basically some information sharing can be really helpful there. And then if it doesn't change, if this person is still really kind of beating that over your head, setting boundaries and being okay with those boundaries. So, if you're having a terrible day and this person tends to just give you that toxic positivity, maybe you don't go to that person on your terrible day, because that's a boundary you need to set, because their mindset is going to be more harmful than helpful.
Yeah, good advice. Okay, well, we don't have any other questions in the queue, so I'd like to thank everybody again for joining us. And we look forward to seeing you all again next month. We look forward to seeing Devin again next month. And registration is now open for her next webinar. And we'll see you in a few weeks. Thank you, everybody, for joining us. Have a great week.
Have a good afternoon.